Good morning, everyone. Today we are going to see about sickle cell anemia. Sickle cell anemia is one of a group of disorders known as sickle cell disease. Sickle cell anemia is an inherited red blood cell disorder in which there aren't enough healthy red blood cells to carry oxygen throughout our body. Normally, the flexible and round red blood cells move easily through the blood vessels. In sickle cell anemia, the red blood cells are shaped like a sickle or crescent moon. The rigid and sticky cells can get stuck in the small blood vessels, which can slow or block blood flow to oxygens to the part of the body. There is no cure for most people with sickle cell anemia, but treatment can relieve pain and prevent complications associated with the disease. Symptoms. Signs and symptoms of sickle cell anemia usually appear around 5 months of age. They vary from person to person and change over time. Signs and symptoms include anemia. Sickle cell breaks apart easily and die, leaving you with too few red blood cells. Red blood cells usually live for about 120 days before they need to be replaced. But sickle cell usually die in 10 to 20 days, leaving a shortage of red blood cells which leads to anemia. Without enough red blood cells, our body can't get enough oxygen, which causes periods of pain. Periodic episodes of pain, called pain crisis, are major symptoms of sickle cell anemia. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joints. Pain can also occur in your bones. The pain varies in intensity and can last for a few hours to a few weeks. Some people have only a few pain crises a year. Others have a dozen or more pain crises a year. A severe pain crisis requires a hospital stay. Some adolescents and adults with sickle cell anemia also have chronic pain, which can result from bone and joint damage. Swelling of hands and feet. The swelling is caused by sickle-shaped red blood cells blocking flow to the hands and feet. Frequent infections. Sickle cell can damage your spleen, leaving you more vulnerable to infections. Doctors commonly give infants and children with sickle cell anemia vaccination and antibiotics to prevent potentially life-threatening infections such as pneumonia. Delayed growth of puberty. Red blood cells provide our body with oxygen and nutrients required for growth. A shortage of healthy red blood cells can slow growth in infants and children and can delay puberty in teenagers. Vision problems. Tiny blood vessels that supply our eyes can become blocked with sickle cells. This can damage the retina, the portion of the eye that processes visual image, and can lead to vision or symptoms of stroke. If you notice one-sided paralysis or weakness in the face, arms or legs, confusion, trouble walking or talking, sudden vision changes or unexplained numbness or a severe headache, call the local emergency number right away. Complications. Sickle cell anemia can lead to a host of complications, including stroke. Sickle cell can block blood flow to an area of our brain. Signs of stroke include seizures, weakness or numbness of our arms and legs, sudden speech difficulties, and loss of consciousness. Acute chest syndrome. An infection or sickle cell blocking blood vessel in our lungs can cause this life-threatening complication, resulting in chest pain, fever, and difficulty in breathing. Pulmonary hypertension. People with sickle cell anemia can develop high blood pressure in their lungs. This complication usually affects adults. Shortness of breath and fatigue are common symptoms of this condition, which can be fatal. Organ damage. Sickle cell that blocks blood flow to organs deprive the affected organs of blood and oxygen. In sickle cell anemia, blood is also chronically low in oxygen. The lack of oxygen-rich blood can damage nerves and organs, including our kidneys, liver, spleen. This can be fatal. Blindness. Sickle cell can block tiny blood vessels that supply our eyes. Over time, this can damage our eyes, which leads to blindness. Leg ulcers. Sickle cell anemia can cause open sores in our legs. Gallstones. The breakdown of red blood cells produces a substance called bilirubin. A high level of bilirubin in our body can lead to gallstones. Pregnancy complications. Sickle cell anemia can increase the risk of high blood pressure and blood clots during pregnancy. It can also increase the risk of miscarriage, premature birth, and having low birth weight babies. Prevention. If you carry a sickle cell trait, seeing a genetic counselor before trying to conceive. Prevention. If you carry a sickle cell trait, seeing a genetic counselor before trying to conceive can help you understand the risk of having a child with sickle cell anemia. They can also explain possible treatments, preventive measures, and reproductive options. Thank you.